Will your vagina hurt after menopause? Menopause is a physiologic issue. Every woman will go through menopause. I am 46 and I am living that, so I can understand you what you are going through, how you feel during menopause transmission and after menopause. Can't say that it is difficult, but it is a way of adaptation. So you need to change your daily activities, daily life, daily habitudes so that you can adapt the new form of you. As you know, in menopause, your ovaries stop producing estrogen and progesterone. It is still produces very tiny, but not as before. That decrease in the estrogen and progesterone will affect the quality of the skin at the vulvar area and inside the vagina. So in the vulvar area, which we called the vulva, inner lips, outer lips, and the pubic area, the skin will be thinner and more fragile because of the low estrogen effect. So if you continue to use like washing soaps, foams or deodorants into that area, if you continue using that, because of the thin structure of the new skin, it may cause problem after menopause. So it is a good idea to stop all of these chemical products when you go through the menopause, as well as I will not recommend it before menopause also. The vagina gets thinner and a little bit tighter, which is good actually, because you might feel a natural tightening in your vagina after menopause, which will increase maybe your sexuality. This doesn't mean that you will have decreased sexual libido or sexual satisfaction. It will still continue as before, or some women may report that after menopause the sex is better. But some women, very small tiny amount of women, I don't want to give a percentage, but if you are in that group, may feel pain after the menopause. This is because their vagina would not adapt to new low estrogen level. In that case, we give some estrogen creams, estrogen vaginal pills or estrogen oral pills, so that the level of the estrogen will increase a little to keep the level of the vaginal mucosa structure in the certain level. So if you are going through a problem like pain with the pee, pain during sex, fragile vaginal entrance, pain during the sexual intercourse at the entrance, it may be a good idea to ask your doctor, your provider, to prescribe you estrogen medication. The inner lips and the labia majora may sag after the menopause because the structure may be a little bit loosey and the fat in that area will decrease. This ends up with the sagging of that area. So if you have any problem like that, you need to have some procedures or inject some products in that area to keep them plumper and more hydrated. So in our clinic, for example, we do Aptostress to the labia majora, or we do some kind of fillers like Profilo Body. Also, I use Profilo Body for the vagina inside to increase the hyaluronic acid, which is giving the tissue the moisture effect. So it is a very good idea. So in your country, you can ask your providers to do this kind of simple, easy but very effective procedures. These procedures will help you continue your hydrated, tight and plumpy appearance. For the vaginal dryness, this is really difficult issue for some women. I would highly recommend you to have vaginal laser. It is a very simple and effective way of correcting the vaginal dryness. Now in the world, every country, almost 1 out of 10 doctors, gynecologists have vaginal laser in their clinics, so I'm sure you can reach clinics who has vaginal laser, and it's a very simple procedure, only 3 sessions, which the sessions are like 10 minutes, and you have it only once in 6 weeks, and later on you have only once a year application. So it is a very easy procedure and it is very effective for the vaginal dryness and sexual sensation, the vaginal sensation increase in the sexuality. I hope this video will help you when you are going through the menopause issue. If you have any question or concerns, please get in touch with us. Our clinic is in Istanbul. You can also make comments. Please don't forget to like our video so we can reach more women. Hope you all the best.